while food insecurity is something that we have addressed, the other big challenge is just lack of awareness about food,
Mm.
right? We are not, again, we are not taught as in our schools, what is balanced diet. We
Mm.
still follow that whole pyramid and
Correct.
everything, but and everything is so theoretical. So people tell you a protein cow, but what does protein look like in my context? I am a vegetarian who's from the south of India. So
Mm.
what does protein look like in my context?
Mm.
Or I'm like, so that is something that is not being covered. So I think that is one of the biggest challenges, right?
Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from hundreds of successful individuals from around the world. If you are new to our channel, please consider subscribing to it and hit the bell icon so that you never miss an update. Our episodes go live at 1 p.m. and 7 p.m. every day. I am your host, Ashutosh Garg, and today I'm privileged and delighted to have a very, very accomplished individual from Bangalore currently, Shruthi Iyer. Shruthi, welcome to the show.
Thank you, Ashutosh. It's super
Uh,
excited to do this.
Thank you. Shruti is the CEO of the Foundation for Mother and Child Health in India. So, Shruti, let's start talking about the Foundation for Mother and Child Health. Tell me about the scope of work you do at the foundation and give me some examples.
Right. So at FMCH, Foundation for Mother and Child Health, we work on maternal health and malnutrition.
Mhm.
Malnutrition is one of the gravest problems that India faces today. 50% of Indian women are anemic, 40% of Indian kids are born undernourished,
Mm.
which means that these kids will never reach their full potential.
Mm.
And about 50% of this undernutrition is preventable. It is, yes, there are various reasons for undernutrition, including a lack of resources, not having food security, etc. But one of the biggest causes is just lack of information about what is it that one should be eating, about nutrition. And these are things that we are not really taught in school.
Mm.
And as you know, India is a developing nation. As the access to non-nutritive food increases, advertisements are talking about, feed your child this, feed your child
Mm.
that. We find that while people are fuller in their stomach, they're still extremely nutrient deficient.
Wow.
And that is essentially what we look at solving, right? Our theory of change says if families are given access to contextual, timely, and actionable information about nutrition, they will make the right nutritional choices for themselves, their children, and the community around. And that's what we aim to do. We want to reduce malnutrition. We want to empower families, including mothers and fathers, about the right nutritional choices that they should be making to lead healthier, fuller lives.
Fantastic. So, when you talk about on your website, I was looking balanced nutrition, preventive healthcare, and child development. Tell
Yeah.
me about each of these and what you are doing here.
Right. So, how we run our programs is in the first 1,000 days of a child's life.
Mhm.
The first 1,000 days of the child's life. So, there are only two critical periods in human life when there is growth that happens. One is during the first 1,000 days. That's from the time the individual is pregnant to the time the child is about 2. That's when maximum brain growth happens, physical development happens, etc. And the second is during adolescence.
Okay.
So we focus on the first 1,000 days, and we look at making sure that the family is informed enough to take care of the mother as well as the child in that period.
Mm.
So that's essentially what we look at doing. So we are preventing children from going into malnutrition. We are preventing maternal mortality. We are looking at child development from the first 1,000 days
Mm.
lens.
Mm.
And most of this is done through the lens of nutrition. It's
Okay.
to saying, for example, in the first trimester, when the individual is pregnant, do you have access to iron and folic acid tablets? Do you have access to your ANC checkups? Do you know what balanced diet looks like? If you're having morning sickness, a lot of women are not able to eat, but what is it that you can eat at that point?
Mm.
How do you, stay calm? How do you stay balanced? What does family support look like at that point?
Mm.
And all of this then ties down to nutrition, which says that That is the key to a balanced and healthy life.
Mm.
Once the child is born, is the child being breastfed? For
Okay.
the first 6 months, the child needs to be exclusively breastfed.
Mm.
And after 6 months, the child needs to start having complementary food.
Mm.
So, is that being started on time? What does that look like? So, all of this together tie up to make our 1,000 days intervention.
Amazing. And I remember when we were expecting our first child. My mother used to have her grandmother's remedies, which she
Yeah.
gave for nutrition to my wife. What is the role the the woman's in-laws or mother play in the nutrition?
Yeah, it's huge. I mean, I'm so glad you asked this question, Ashutosh. So, we normally, when we say nutrition and family, everyone puts that whole burden on the mother. But
Mm.
actually, it's a whole ecosystem that
Okay.
needs to be empowered.
Mm.
Fathers play such a critical role. Father-in-laws, power dynamics in families are so critical to bring about holistic change.
Mm.
So it's essentially it's a whole ecosystem that we need to empower.
Mm.
What also becomes an added layer of complexity is migration, because in the communities that we work in urban slums of Mumbai through direct intervention,
Mm.
and we've seen that a lot of our the families that we work with are migrants, which means that they don't have a mother or mother-in-law to give them these
Correct.
little
Okay.
home tips because they're all at home, right? And so then we sort of become the first point of contact to tell them. Also, what happens in migrant communities, especially in Mumbai, is it
Mm.
is so diverse. So you will find one lane of families from the south of India where you need to talk about, say, have your idli, dosa,
Mm.
etc. And then you have somebody from UP, and then you have somebody from Bihar, where
Mm.
the food choices are completely different, and food
Correct.
is so personal,
Mm.
and so that adds a layer of complexity. But I think that's when change happens, right?
Mm.
When it is really uh, when it when it's something that you can adapt to, you realize these small changes that you can make in your life, which is easy, it's low cost, and it is so nutritious for the child. That's when behavior change really happens.
Amazing. And now let's move on. And after the nutrition, you talk of preventive health care.
Right.
Now, I'm assuming that one is the preventive health care while uh, the child is in the womb, and then
Yeah.
for 2 years after that.
Right.
So, what
That
do
is
you,
that is sorry. You're
I said,
saying?
what do you look for in healthcare needs?
Right. So in preventive health, one of the things that, and we are soon realizing, I think there are multiple paths to this, right? Preventive health can go back to as much as an adolescent girl.
Mm.
When she starts getting her periods,
Mm-hmm.
at that point, does she have the right nutrition so that her body is developed enough?
Mm.
Then when she's ready to become a mother, when she's going to get pregnant, does
Mm.
she have the right information? Is she having the right nutrition?
Mm.
And all of that falls into the gamut of preventive healthcare. Where we also, and another added dimension, what we really look at is making sure we use a lot of data to do preventive healthcare. So we do anthropometry every month. That's measuring the height and weight of the child every month
Mm-hmm.
to make sure that the child does not go into a state of malnutrition. WHO has all of these charts defined, which says there's severe malnutrition and moderate malnutrition.
Mm-hmm.
So every month when we do the anthropometry of the child, we tell the mother, see, आपका बच्चा थोड़ा कम हो गया है. Your child has come down in weight, so you need to bring that child up.
Mm.
Then the next month, the mother is, extra careful, making sure the child is well fed, etc. So that is our gamut of preventive, right? So saying let's not wait for a chance for the child to go into a state of malnutrition and then you work on that child.
Right.
But can you preempt some of these things?
Very interesting.
Uh,
And then the third one, which is child development. So, talk to me about child development also.
I think again, like child development is just central to all of this. Like women empowerment and child development is just the heart of everything that we do. One of the things that we have seen is, all parents want their children to be healthy. All parents are willing to bring about behavior change in their habits for their child's needs. And that's essentially at the heart of what we also want to do. Right. So making sure that children are healthy till the age of 2. if a child is healthy, the child is going to uh, be intellectually be able to reach her full potential,
Mhm.
physically reach her full potential, which means that the child will fall less sicker in school,
Correct.
which means the child will do well in studies, which means the child has a better chance of getting out of that cycle of poverty,
Mm. Right.
right? And so that's what we look at in child development.
Fantastic. So, you mentioned that a very large number of children in India face malnutrition. What are some of the nutrition challenges we face in our country?
And this is, I think, Ashutosh, I can't speak for the country as
No,
such because it is so nuanced. In
correct.
different places, there are different challenges.
Mm.
In tribals, it could be food insecurity. In rural communities, it's very different because there is food available, but is it nutritious enough? Is it giving a balanced meal? In urban communities, it's a very different challenge.
Mm.
I'll speak a little more about the urban poor,
Okay.
and some of these are applicable everywhere else
Mm.
as well. I think while food insecurity is something that we have addressed, the other big challenge is just lack of awareness about food,
Mm.
right? We are not, again, we are not taught as in our schools, what is balanced diet. We
Mm.
still follow that whole pyramid and
Correct.
everything, but and everything is so theoretical. So people tell you a protein cow, but what does protein look like in my context? I am a vegetarian who's from the south of India. So
Mm.
what does protein look like in my context?
Mm.
Or I'm like, so that is something that is not being covered. So I think that is one of the biggest challenges, right? The other thing is also, and this is goes into layers. If you start peeling them, it goes into things like cultural practices, social practices. So a mentor once told me, I asked her, what's the one thing that you would do to make sure nutrition goes away from the country? And she says,
Mm.
make sure girls eat first at home,
Mm.
right? Normally, when we see, at home, women eat last. They serve everybody, girls eat last, which means that they're eating much lesser,
Yeah.
which means that they don't get enough nutrition.
Mm.
So some of these are also just cultural practices that cause malnutrition.
Mm.
So it's not a one size fits all sort of an answer. As you unpeel these various layers, it becomes more complex and you realize that some of these things are just so interconnected.
Mm. And as you mentioned a little while ago, in Mumbai, where you said, there are so many different uh, people from so many different states. I mean,
Yeah,
nutrition needs, etc., will be very different.
absolutely.
Mm.
Absolutely. And not just the nutrition needs, there everyone's individual taste
Mm.
is going to be very different. And there's no one size fits all in
Mm.
this case.
Correct. And tell me, what is the government doing to
Right.
support nutrition amongst the masses?
Right. So the government has got a bunch of missions, right? So the National Health Mission, and then there's the Portion 2.0, which has been the Portion Abhigyan, which was in action till about last year, and now it has become Portion 2.0, which says we have to reduce malnutrition. There is definitely a lot of efforts by the government to empower the ICDS, that
Mm.
is the Anganwadi services. They give take-home ration. The height weight measurement for every child comes under the ICDS. There are nutrition rehabilitation centers for children who are in a SAM category, like severely undernourished children who are close to mortality. They can register themselves at a nutrition rehabilitation center. So there are schemes and initiatives by the government, uh, and the government is doing what it can. However, the scale at which we are facing this problem, I don't think the government can solve it alone. We require corporates, we require civil organizations, we require community-based organizations, we require communities, farmer produce organizations, everyone to come together and work on this. That's the only way we're going to solve this. Uh,
Amazing.
yeah.
Amazing. And have you also looked at CSR from so many corporates?
Yeah, we do, we do. So we are pretty much we're funded mostly by CSR, and
Okay.
I think we are very grateful to have some wonderful CSR partners who
Mm.
understand the gravity of the situation
Mm.
and continue to support us year on year.
Right.
It's hard to actually say. I mean, at least in the work that we do, it's very easy to see impact because we see children who are undernourished to becoming well nourished, right? We see mothers delivering healthy babies.
Mm.
So that's really nice. But also we have seen that we are not giving out food.
Mm.
So it's harder to explain that lack of knowledge, lack of awareness is one of the key reasons for
Mm.
malnutrition.
Very
And
true.
that's something that we're also trying to bring a dialogue around.
Phenomenal. And you're currently focused on Maharashtra. Any plans to expand beyond that?
Yeah. So while we focus in the urban slums, what we want to do is look at partnerships to expand beyond.
Mm.
We want to work with community-based organizations, and currently that's the strategy that we are looking at
Mhm.
as of now. Community-based organizations, or look at other civil society organizations. Or institutes that would want to take our work. So we've got a tech piece in place. We've got our programming in place. So we train organizations outside of Maharashtra to continue to do this work. We train frontline workers who then do this work across the rest of India. So we've got a partner, in fact, in Pune. We've got a partner who'll probably start work soon again, so all depending a little bit on funding in
Mm.
rural Karnataka. We've in fact got a partner in Nepal.
Oh, wow.
They just started work last month.
Mm.
So we're also seeing that, I think the innovative part of our work is using technology. Is having been on field for about 10 years now, we sort of have an idea of what causes behavior change. We listen to the community. We make our content very contextual,
Mm.
very actionable. So over the 1,000 days that we work with a family, we meet them about 31 times. We conduct community events. We work
Mm.
on the entire stakeholders, not just the mother, to bring about that holistic change. We work with the system, with the Anganwadis.
Mm.
So our partners sort of like this model, and they take this whole thing and they do it with in their own region.
Quite incredible. 31 times in 1,000 days means almost every third day,
Uh, in 1,000 days, it's almost going to be once a month.
once a month.
Close to once a month.
Okay, okay.
Yeah, yeah,
So
yeah.
let's now move on. What would you say, Shruti, is your leadership style? I mean, you're must be leading a team of large people and some very sensitive work.
Yeah. Uh, I think, Ashutosh, and I don't have a definite answer to this. I think my leadership style has evolved, and I've seen it evolve
Mm.
over years. Uh, the Beatles say uh, the further one travels, the less one knows.
Correct.
And I think I feel sort of similar to that. And what I'm building right now, I can speak a little more about that. Is I think I'm trying to be more mindful in each action,
Mm.
being able to make sure that my intentions of being there, I am mindful of those actions. I think that's what I am trying to build as of now. In terms of how I manage the team, I think I always I, I I feel like I want my team to be able to take on the work in a way where if tomorrow I am not there, the work shouldn't stop,
Well said.
right? So that's essentially my goal.
Very well said. Very well said. So let's now move to the last part of our conversation, which is some questions for you personally. And my first question to you, Shruti, is what would you say are three key milestones in your life or your career?
I think one of and this sort of changes with time, but I think the uh, the two fellowships that I did, the Teach for India fellowship, which was my induction into the social sector.
Mhm.
I knew very little about the social sector. I was about 23, 24, and fairly privileged background. I've lived across metro cities,
Mm.
but really going into a classroom which was low resourced and teaching in that classroom for 2 years, meeting people of a very different socioeconomic background.
Mm.
It was a very beautiful experience for me.
Mm.
I and while that experience was great, I don't think I had the vocabulary to capture my learnings and capture my feelings.
Mm.
And that's what my second fellowship gave me, the Acumen Fellowship. It gave me a community of people who and this is a word that we use in the fellowship very often, gave me the one arm hug. So they say it's a hug with one arm and then they push you with the other.
Yes.
So that became a very
Mhm.
important moment. And I think the third one definitely has to be the time that I got married.
Wonderful.
Uh, I think I realized a lot more about. I think marriage is quite transformational, and I'm sure.
Mhm.
uh,
Absolutely.
I,
So my next question to you, Shruti, is you're in the social sector. What are some of the core values you believe in?
uh, Again, this has evolved over time. As of now, I think number one is choice for everyone.
Mm,
No matter what, no matter where you come from, you should have the choice
mm,
to do what is it that you want to do, right?
right.
Uh, and I think with that comes dignity,
Mm,
right? Dignity and quality of life for everybody,
mm,
including starting with yourself, right? Very often we don't ask enough of ourselves.
mm,
We don't ask enough for ourselves. Um, so really, how do you make sure that you are asking enough for yourself, and then extending that to everybody, realizing that everybody deserves,
mm,
and not just humans, right?
mm.
Animals and plants and the planet. Everyone deserves to have a dignified life.
Correct.
Everyone deserves choice.
Very well said.
I think
So a follow-up question to that is that, Shruti, from where you stand today, um, what does success mean to Shruti?
I think it's very related to choice. I think it's uh, having the ability to choose what you want to do
Mm,
um, in a way that lets you be the best version of yourself,
okay. Very, very.
right? So you choose to be a leader, and that lets you be the best version of yourself. You choose to whatever choices you make, uh, you are you can occupy that space,
Mm,
right? To me, that really is success.
wonderful. I have time for two more questions for you. My next question is, who or what inspires you?
This is a fairly simple one.
Mm,
I think uh, women who stand their ground
mm,
uh, and are not apologetic about occupying space.
mm,
I'm always inspired by women who, just uh, say that no, I deserve this, because I know how hard it is for women to do that.
correct.
Just the conditions in which we've been, just the patriarchy around us, etc.
Mm,
Uh, and I specifically speak about women because again, that's an identity that I relate with very,
mm,
very closely.
sure, sure.
Uh, but I think women leaders who just stand up, even women from the communities that I work in, my own frontline staff,
Mm,
right? When I see them come and say, this is not okay, and even when I tell them, we need to do things a certain way, but then they come back and say, no, we should be doing this differently. I
mm,
think the confidence, the passion, the will to just stand up and say, no, listen, I think different. I think this is what should be done. Voice your opinion. I think that just inspires me so much, and I know
amazing,
I feel so hopeful about the
amazing.
world in general.
What a great answer. And my last question to you, Shruti, now is about failure. I've often said, and I've actually got a new book that was published 3 weeks ago. I've often said that parents in India, or for that matter, Asia, don't teach children it's okay to fail.
Yeah,
You're always told, come first, go to the head of the line, etc., etc. Yet we fail and we learn.
yeah, yeah.
My question to you is that what have been your learnings from your mistakes?
Right. Uh, and honestly, if there was one mistake, then I could actually say what was the failure.
Well, I told someone I have written a whole book on it, so you can imagine how many I must have made.
So in fact, last year I wrote an article on IDR around one of my failures,
Mm-hmm.
uh, and there have been like several learnings from that, right? But I think the one thing that really stands with me is not shying away from hard conversations
Mm-hmm.
and tough decisions.
Mm-hmm.
um, I think that's been one of my biggest learnings, right? Take a decision, and This is something that also comes from my father, who pretty much always says, indecision is also a decision.
Correct.
Right? So, you analyze the pros and cons, and you take a calculated risk, but take a decision. And I think that's definitely been one of my biggest learnings from multiple failures. I'm still getting better at it, but it's very easy to overthink, especially in the space that we are in, right? You realize that you want to do this and that, and my previous boss used to tell me, you're not God. And it's true, you're not God. And I think just realizing that and just taking a decision saying that this is what I can do at this point, and being okay with it. I think that's definitely been like a big learning, just humbling yourself down.
Fantastic. Shruthi, thank you so much. I mean, I've so enjoyed my conversation with you. I particularly liked your inspiration about strong women who can put their foot down and say no. And I have a lot of respect for such women. Thank you again, and all the very best.
Thank you so much, Ashutosh. It was really nice speaking with you. I just didn't realize how time passed.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.